nurse for today, and I'm going to do a head to toe assessment. I'm just going to wash my hands. Can I get your name and date of birth?
Mercer, 12/8/1992.
All right. General survey. Client appears stated age. Sexual development is appropriate for age. Skin is pale pink. No obvious lesions. Nutritional status is adequate. Mood is cooperative. Body is symmetric. Head is erect. Level of consciousness is alert and oriented. She is dressed for the appropriate climate. She appears well groomed, good hygiene. I've already obtained my vital signs. They are within normal limits. And I'm going to get started with my exam. I'm going to give you 4 words. You can remember those. I'm going to ask you throughout the exam. Mountain, blue, sky, bike. Good. I'm going to start with the head. The head is normal cephalic. Hair is evenly distributed. There are no obvious lesions. The temporal artery is smooth, even, regular. Can you open your mouth for me? Close it. The temporal mandibular joint is smooth, no pain, no tenderness. I'm going to palpate your sinuses. Let me know if you have any pressure. No tenderness. No pressure or tenderness in the sinus. Can you frown for me? Puff your cheeks. Raise your eyebrows. Close your eyes. Cranial nerve 7 is intact. The eyebrows, eyelashes, eyelids, and eyeballs are all symmetric. The conjunctiva sac is pink. Sclera is glossy white. Can you read what this says for me? Merry Christmas. Good. And stare straight ahead, just over my shoulder. Cornea is clear, no cloudiness. Cornea light reflects, the light reflects on both eyes symmetrically. I'm going to do the pupillary test. I would normally dim the lights for this. Pupils constrict symmetrically. You can follow my fingers for me. Good. Eyes cross on the same axis. You can follow my fingers one more time. Up. Side. Down. Cranial nerve 3, 4, and 6 are all intact. Do you remember those words that I told you?
Mountain, light, blue, sky.
Good. Let's go to your ears now. Any pain or tenderness?
No.
Good. Any pain or tenderness?
No.
Good. Ears are symmetric, proportion to body. She does have bilateral hearing aids in both ears. I'm going to go behind you. I'm going to say 3 letters or words if you can repeat them after me.
ABC.
1, 2, 3.
1, 2, 3.
Good. I'm going to go to your nerve. Cranial nerve 8 is intact with the whisper test. I'm going to go to your nose. Can you close your eyes for me? What is that?
Alcohol.
Good. Cranial nerve 1 is intact. Nose is midline. It is proportion to the body. Any pain or tenderness?
No.
Good. Can you sniff in for me? Good. Patency is clear. There's no occlusions. Can you lift your nose up? Turbinates are present, moist, red, no deviation or no perforation. Your mouth. Lips are darker pink, and then the buccal-mucosa. Buccal-mucosa is light pink, moist. Smile for me. Teeth are white, straight, no signs of decay. Gum margins are tight, well fitting. Open. Hard palate has transverse rugae, white. Soft palate is pink. Can you stick your tongue out? Tongue is midline, no tremors. Open and say ah. Uvula rises midline. That is cranial nerve number 10. The tongue, when she stuck her tongue out, that was cranial nerve number 12. I would do the gag reflex. I'm not going to do that for this test, but that would be cranial nerve number 9. Open one more time. Tonsils are absent. They are grade 0. The client has had a tonsillectomy. I'm going to go to your neck. Trachea is midline. The neck is erect. I'm going to palpate the carotid artery. Smooth. I would listen to the carotid artery starting at the jaw with my bell. At the jaw, I would have her take a deep breath, and on exhale, I would have her hold it at the mid-cervical, and then the base of the neck. Would do that on both sides, at the jaw, mid-cervical, base of the neck. I would expect to hear no grooing. Accessory muscles are present bilaterally symmetrical. Can you turn your head to the side? Look over there at the shoulder. Chin up, down, and then touch your ear to your shoulder. Other side. Shrug your shoulders, down, and then shrug again. Cranial nerve 11 is intact. The thoracic rib cage is in a downward slope. The pelvic is spine. Spine is straight and midline. Take a deep breath. Equal expansion symmetrically. I'm going to say 99 for me as I move my hands down your back.
99, 99, 99, 99, 99.
Good. That is tactile firmitis. There is equal vibration bilaterally. I'm going to listen to her back for her lung sounds using my diaphragm. There's 9 different spots I would listen to on the back. I would listen for 1 full respiration cycle, so 1 inhale and 1 exhale. My name is Melissa. I'm going to be your nurse today. Is it okay for you to have one? 4, 5, 6, 7, 8, 9. I would expect to hear no adventition sounds. Lung sounds should be clear bilaterally with no crackles or no wheezing. Do you remember those 4 words I told you?
Mountain, bike, blue sky.
Very good. I'm going to look at the chest. Skin trigger is good. It's less than 1. I'm going to listen to her chest in 5 different spots using the diaphragm.
Mental status,
Starting above the clavicles. 1.
well oriented. Her face is, facial expression is calm. Her posture is relaxed. Her skin's coming, looks even. 5.
I should hear no extra sounds, no adventition sounds. Lung sounds should be clear bilaterally. No crackles or no wheezing.
Karen, I'm going to,
Respiration, as I took earlier today, they were 16, even.
those 4 words back to me. Try to remember.
I'm gonna look at your arms. Can you put your arms around for me?
Okay?
There is, skin is
Banana.
pale pink. There's no obvious lesions, no rashes. She does have a tattoo on her right wrist.
Height, weight, and BMI. And we're gonna
Temperature is dry, is warm, skin is dry, no edema present. Fingernails, nail beds are light pink. Capillary refill is less than 3. Nails are curved with no clubbing. Can you grab my hands? Squeeze them. Good. Hand grasps are equal bilaterally. Can you put your arms up on your hips? Squeeze your palms together. For breast exam, there is no leg or retraction. If I did know any, I would then go ahead on to palpate the breast. Go ahead and lay down for me. You turn your head that way. The jugular vein is noted while she's laying flat. As I raise the head of the bed, the jugular vein should disappear at 45 degrees. The jugular vein is absent. Put your head down just a little bit. Head down. Inspecting the anterior chest, I notice no heave or no lift. I will try to palpate the apical pulse. It is not palpatable, but that is normal. I will listen to the apical pulse for 1 full minute, noting rate and rhythm with the diaphragm at the 5th intercostal space, mid-clavicular. I should hear no extra sounds. Normal is between 55 and 60, and it should be regular. I would then listen for any murmur, starting at the, we're gonna start up at the top. And start at the mitral, at the aortic, pulmonic, Erb's point, tricuspid, and mitral. Then again, I would listen with the bell at the mitral, tricuspid, Erb's point, pulmonic, and aortic. I should hear a normal, I should hear no blowing or no swishing, noting no murmur. I'm gonna lay you flat now as I take a look at your abdomen. Lower your head if you like. Thanks. The abdomen is flat, umbilicus is present, midline inverted, no discoloration or no hernia noted. I would then go ahead and listen for bowel sounds with the diaphragm. I would start at the right lower quadrant. I would listen for 5 to 30 sounds. Once I hear those 5 to 30 sounds, I can move up to the right upper, and the left upper quadrant, and the left lower quadrant. I would then use the bell and listen for vascular sounds, starting at the aortic, renal, iliac, and femoral. I should hear no bruit. I'm going to go ahead and palpate the abdomen and noting for any tenderness or masses. Let me know if you have any tenderness. Any tenderness? No tenderness or no masses are noted. Demeanor is calm. No guarding is noted. I would then inspect the perineal area, asking if there is any rashes, lesions, itching, frequent urination, any pain with urinating. Nope. Good. I would then go down to the legs. Legs are symmetric bilaterally. Skin is light pink. Skin is warm, dry, no edema noted. Hair is absent bilaterally. There is a tattoo noted on the left ankle. Toes, I am unable to expect the color due to the toenail polish and the capillary refills, but I would check it and I would expect it to be less than 3. Go ahead and push against the head. Good. Good. She has equal strength on both feet bilaterally. I would then palpate for the dorsal pedial pulse. Should be smooth and regular, plus 2. The posterior tibial and the popliteal. I would do those on both legs. I should feel the same on both sides. Now I'm going to check for her plantar reflex. And bend your foot a little bit. All right. And this one. Good. Both of her feet react to that. Go ahead and sit up for me. You can close your eyes. I'm gonna do a couple tests with your eyes closed. Let me know if you can feel what part of your body I'm touching. Cheek,
Arm. Hand. Shin. Foot.
good. I'm gonna put an item in your hand if you can tell me what it is.
A rubber band.
Perfect. And then I'm going to draw a number on your hand. You can tell me what number it is. It's gonna face you.
7.
Good job. Now you can turn your hands over. What finger am I touching?
A right ring finger. A left pinky.
Good. Go ahead and open your eyes. And then do your hands back and forth for me. Perfect. And then we're gonna do heel to shin. Good. You can stand up for me. Close your eyes. This is checking for cerebellar ataxia. It's a Romberg test. You want to have a seat? There was no swaying. Do you remember those 4 words I told you?
Mountain bike, blue sky.
Musculoskeletal, if I expected any abnormal signs, there would be further testing as indicated. If I suspected any abuse, which I do not, I would do further testing as indicated. And then if there was any mental status changes, I would do further testing as indicated. I do not suspect any of those. I'm going to wash my hands, and thank you for your time. What I missed.